Hi, I'm Colt, and today we're going to demonstrate the correct method of injecting testosterone. This is a vial of testosterone. Now, the first thing you should do is to check your vial to make sure that it is testosterone cypionate. You should also confirm the dosage you were prescribed. You should always follow the 5 R's of medication administration: right patient, right medication, right dose, right route, and right time. Before you start the preparation and injection process, begin by thoroughly washing your hands with soap and water for at least 20 seconds to ensure cleanliness through the whole process. First, remove this metal covering on the vial. Once you've done this, take an alcohol wipe and rub it for about 5 seconds on top of the vial to make sure that it is clean. Then, put the wipe aside as you will use it again in a moment. Your testosterone package should have come with 2 different size needles, one larger gauge needle and one smaller gauge needle. You will be using both sizes in this method of drawing your testosterone. First, take the plunger portion and pull back a bit on the plunger to get a small amount of air into the barrel of the syringe. You will start by connecting the large needle to the plunger piece like this. Once the syringe is prepped and you have cleaned the top of the vial, you are now ready to withdraw the testosterone. Next, insert the needle into the vial. Turn the vial upside down and push the plunger to get the air into the vial. This makes it easier to withdraw the medicine. Once you're done with that, begin pulling down on the plunger to slowly draw the medication into the barrel of the syringe like this. You should pull in more medicine than your required dosage so you can then push the plunger back and get any bubbles out of the barrel. Your provider should have given you a prescribed dosage and shown you where that is on the syringe. If you aren't sure of the correct dosage, contact your provider before you do an injection. Once you've pulled the medication into the syringe, you will then need to remove the large needle and replace it with the small one. To remove the large needle, you will first replace the needle guard on it. Then, twist and pull it off. Make sure, once you remove the needle, you dispose of it into a safe needle disposal container. Then, you will take the small needle and replace it on the plunger like this. You now have a fully prepped syringe. The last step before injecting is to remove the needle guard and do a very slight push on the plunger like this. Doing this gets out any air from the needle. Once you see that bubble come out, you are done. Now, you're ready to inject. For the purpose of this video, we will be demonstrating the injection on the outside of the upper thigh. Our recommended location is the upper thigh and the quadricep muscle, which is a great, large muscle mass to inject the testosterone into. You want to do your injection about midway between the knee and the hip, which is in this general area. You also want to be a bit outside of the midline and avoid injecting anywhere in the inner area of the thigh. Please know that although the thigh is recommended, you can also inject into the upper buttocks, but for safety reasons, only do so if you're instructed by your provider. So now that you're ready to inject, get your alcohol wipe again and clean the injection area. Grab the area of the thigh you will be injecting, ensuring that the area has plenty of tissue. If you have any trouble reaching across your opposite thigh, you are fine to inject without grabbing the area. Now, you inject the testosterone somewhat like a dart, using your dominant hand. Try to avoid slow needle insertion, because that's sometimes uncomfortable. So now that the needle is inserted, you should pull back a little on the plunger, just to get some suction and confirm that the needle is not in a blood vessel. If you do happen to see blood, simply remove the syringe from the thigh and start this process over again by attaching a new needle, sanitizing the area again, and then re-inject in a slightly different location. Please know that puncturing a blood vessel is unlikely, but it's something you should check first. Now, you are ready to inject the testosterone. Grab the barrel of the syringe like this with your non-dominant hand to stabilize it, while using your dominant hand to slowly push down on the plunger to inject the testosterone. Once you have emptied the barrel of all medication, you are finished injecting. Now, remove the needle by pulling it straight out. Rarely, you might get some bleeding, but it will be minimal if you do. If you do get a bit of blood, dab it off with the alcohol wipe, then give a little massage to the area using the alcohol pad, and you're done with the process. Immediately following the injection, it is imperative that you dispose of your single-use needle safely. Visit safeneedledisposal.org for additional resources on how to properly do so in your state. For most individuals, the testosterone injection is fairly easy to do and relatively painless. As always, be sure to discuss any and all aspects of testosterone therapy with your medical provider, and make sure you are having regular blood work done and have regular visits with your provider to review your results. Lastly, if you have any heat or flushing at the injection site or any significant discomfort in the area, contact your medical provider. This concludes the demonstration on how to inject testosterone. Remember to never use a needle twice. If you have any questions, contact your medical office or medical provider for assistance.